Good morning. My name is Graeme Osborne. I'm the Director of the National Health IT Board. And the National Health IT Board has been given the challenge of ensuring that New Zealanders have access to their health information. In fact, we have a vision, the eHealth vision, which states that by the end of 2014, New Zealanders will have access to a core set of health information for them to share with their health providers as they work through their health journey and their health pathways. So today, what I'd like to share with you is how do we come to the conclusion of the outcome we're trying to achieve. And the outcome we're trying to achieve is best presented by this tree. We've looked at the international experience and research, and if New Zealanders are going to comfortably engage with the health system and access and share their information, firstly they must trust the whole environment. And you'll see on the diagram here that we have a concept called connected health. Connected health is the branding and the language that consumers in New Zealand can trust. When they see that brand, they know that the information that they're sharing and they're accessing is of high quality. Equally, clinicians need to have that same level of trust, and they need to ensure the information they share with their colleagues and with their consumers and their patients is of high quality and is going to be used appropriately. And then the third thing we need to get right is we need to make sure that clinicians can engage with their colleagues very successfully in the continuum of care. So putting all that together, if you think of it from a consumer's point of view, the outcome we want is health information that is coherent, that over a long period of time, in fact, for the full lifetime of somebody in New Zealand, their health information connects together. And we best describe that in this diagram here of a tree. It's a lovely Kahutakawa tree. It's on an island in the Hauraki Gulf. And if you can imagine your health information being developed over your lifetime, the tree respects the fact that everyone's health experience will be different. So depending on how well you've been or whether you've had a recovery from an accident, you'll have different branches and your tree will have a different shape based on that experience. So of course, for a tree, you need to have strong roots. And so the first thing we need to do is ensure we have foundational health information. And these are things that we know well, the National Health Index, the ethnicity database, the immunisation database, and the clarity of the roots is that this is the role the Ministry of Health will play. In addition, we need the connection point, the trunk of the tree, and this is how we ensure that connected health is the mechanism so that all the parties in the health sector can play effectively together and securely. The third layer we need is some common clinical information. Now the reason we need this is when we talk with consumers, they say they're very happy for their information to be shared, particularly the objective data, the results, the things they can't argue with. So there is a view that we need to get this common infrastructure in place, and in fact we're looking for the district health boards on a regional basis to implement this capability. Now the third layer we want to see in place to support this concept of the tree is we need to focus on the continuum of care, and this is a lot of the work the ITB board's been doing around ensuring we have medications flowing right from the community into the hospital and back to the community again. We have referrals, we have discharges, and other activity that is managing the pathway between primary and secondary care. So in the primary space, we are asking PMS vendors to offer solutions that are much more connected to the rest of the ecosystem. In the secondary space, we are looking for, on a regional basis, a much more consistent set of hospital systems. And we'll talk a little more about that in terms of CRISP in a moment. Now, to top it all off, if you can imagine that for most people in New Zealand that will be enough and that will work well, but there will be a percentage of New Zealanders who are really unwell or are recovering from a major accident or injury, or possibly they're going through a life stage event. And clearly the best one that we all understand around that is the maternity experience over many months. And so we think there's a need to support multidisciplined care, and on a national basis we want to have a tool that allows different parties across the health sector, particularly clinicians but also other health workers and the patients themselves, to access a shared care record. So it's a combination of these four layers that creates the outcome we're trying to achieve. The way that patients will access the information predominantly will be here through the general practice, and we can talk about patient portals, but this is the area we're focusing on. And also for those people in that percentage of people who are recovering from major illness or injury or going through a life stage event. So I'll finish by just saying CRISP is incredibly important to the National Health IT Board, and it's important because, as well as the Ministry, there are some fundamental building blocks. This one here, the Common Clinical Information, sometimes known as a Clinical Data Repository, and this area here, Common Hospital Information Systems that link all the way out into the community and back into the hospital. These are critical aspects of what CRISP needs to deliver for us on a regional basis in order for this whole tree to work on a national scale. And we're working with the other 3 regions to deliver on those same capabilities. So thank you for listening. You'll now know what the tree is all about, and it's a consumer view of the outcome we're trying to achieve with the work of the Health IT Board.